legal assistance for seniors in Oakland. I have so much affinity toward Taiwanese culture and the language. I am not Taiwanese, so I know I look very Chinese, but I'm Korean. Both Korean and Chinese. You just don't believe me. I go to Chinatown and I say, no, I don't speak Chinese, I'm Korean. They just keep speaking to me in Chinese, and I really enjoy that. In college, many years ago, I took a year or so of Mandarin, and it was just one of my favorite languages. Of course, I forgot everything. But, so when I listened to Mandarin, I could hear a little bit. And it's just, I know that I was Mandarin speaking before life, my former life. So I'm just very happy to be here. I'm always so inspired by the HICAPS program workers, the Taiwanese group, a group of very, very dedicated volunteers who are serving their communities. Our seniors, especially the monolingual immigrant seniors, cannot possibly navigate through this healthcare system or any of the public benefit social service systems without help. Okay, so I serve Alameda County in community education with Medicare, and the white American, the Caucasian people who are born here, their parents born here, their grandparents were born here, they speak English, and they spend all their life in the U.S. They cannot possibly navigate through the Medicare system alone either. So legal assistance for seniors, I'm going to leave all these papers, so afterwards you can just pick up whatever you like. It's started in early 70s by a group of 3 female lawyers in Oakland. They took a lot of cases about seniors, helping them with the elder abuse issues, financial abuse issues, or guardianship issues. So they decided we're going to form an organization to serve these seniors. They deserve it. It's about time. So they started in Oakland with 3 attorneys. Now we have 7 in the areas of immigration, guardianship, of course 2 attorneys in elder abuse and financial abuse, and conservatorship, and we are looking for an attorney for consumer fraud issues. So our attorneys are very, very dedicated to seniors. They've been to some real, really prestigious law schools and universities. They're very able. They're very low paid, but they're really, really good lawyers. That's legal assistance for seniors. HICAP, on the other side, is Health Insurance Counseling Advocacy Program. This started in 1987-88. The California state decided that we need to develop a separate agency to help Medicare beneficiaries to assist them how to use Medicare. So this is a big start, and I think the one in Oakland started in 1988. Alameda County was one of the pilot HICAP program back then. And throughout California, now HICAP is everywhere in the country, all over United States. They just have slightly different names. Like the one in Virginia is called the BICAP. Okay, and there should be one office in every county, no matter how small they are. They're funded to do so. They're funded to help seniors to utilize Medicare. So one in Alameda County is kind of contracted with legal assistance for seniors. They have been kind of married to each other since the beginning. Some HICAP changed their organization, their umbrella organizations. So some organizations were bid for HICAP to be under their house, So sometimes they change, but legal assistance and HICAP has been together since the very beginning. The one in San Francisco is housed by Self-Help for Elderly, another Chinese, mainly Cantonese-speaking service organization. The HICAP San Francisco is with the Self-Help for Elderly. One in San Mateo is with the Self-Help Elderly also, English-speaking one. And one in Contra Costa County is housed by the county office itself. So it is served by county, and as I explain Medicare, you will know why. Medicare Advantage Plan, especially, is divided by counties. So I brought some materials for the drug plans for next year as well, but I will quickly go through Medicare, give you a short overview, even though you know everything about Medicare, right? Yeah? Good. I was just joking. You know, it is such a complicated subject matter. I go to same places every year, and every year there are seniors who ask me, what is the difference between Medicare and Medi-Cal? You know, so it's kind of confusing for the second language or limited English speaking seniors to understand the different system, because, and also they usually have both, right? So Medicare Part A covers any kind of hospital stays or hospital admission or skilled nursing care home, anything that requires your treatment, you know, sleepover type of thing, right? It is covered by Medicare Part A. There's no premium for Part A. For Part B, they cover Medicare medical services such as doctor's visit or any kind of lab work, testing, x-rays, durable medical equipment, you know, the walkers and canes and, you know, the bathroom equipment, whatnot. So that's covered by Medicare Part B. There is a premium to Part B. It was $96.40 until 2009. It went up to $110.50 for 2010. But because our Social Security check amount didn't go up, they decided not to raise the Medicare Part B premium for the people who were already receiving Medicare. So if you have been on Medicare on 2009 or before, your Part B premium stays $96.40. But what happens if you turn 65 on 2010, you are responsible for premium of $110.50. Yeah, it was 110 this year, right? And then 2011, it's gonna go up to $115.40. Yes. So that's for people who turn 65, who enter Medicare in 2011. They are responsible for that amount. If the Social Security check amount does not go up, it will stay as where you started. Okay. Medicare Part C, I will explain after I explain Medicare Part D. Medicare Part D is the prescription drug plan part of your Medicare. It started in 2006, January. I was a service coordinator for seniors back then, so that changed everybody's lives. What happened was Medicare decided to contract out the prescription drug part of the Medicare. So at that time, I think it was well over 100 different pharmaceutical companies in California who contracted with Medicare. So a person has to choose one of those plans.